Hi everyone, I want to talk about Marcu-Gun Pupil. Marcu-Gun Pupil. Marcu-Gun Pupil is a genetic disorder and is very rare. In affected individual, the two eyes will not respond the same way to bright light. Each eye responds differently. It's expected that if you check the optic nerve, that it might be the problem with optic nerve, and retinal damage is a probability. There will be relative afferent pupillary defect when one eye will constrict, that is the expectation, under a bright light. The affected eye, the pupil, will be enlarging in size, that is dilating. That is not expected. There will be visual impairment when you do visual acuity, or the individual will be complaining of blurry vision in one eye, and you have to rule out cataract before you make this definitive diagnosis. You can grade the level of severity of the relative afferent pupillary defect in this way. It is mild if the perfected eye first constricts, then dilates to a larger size slowly. It is moderate when the affected eye constricts and remains unchanged, then after a while it starts dilating to a larger size. It is severe when the affected eye dilates instantly when the bright light is shown. In other words, when constriction is expected, in its severe cases, you are not going to see any form of constriction. It's going to be massive dilation from the onset, regardless of the intensity of the light you directed at the affected eye. You are going to look for retinal detachment that could be responsible. Is there any tumor around the head region affecting the orbit? Any inflammatory process going on? Could this be glaucoma, any neuropathy, optic neuritis, head injury, macular degeneration, or amblyopia? Amblyopia is when there is failure to achieve normal visual acuity. The diagnosis could be made only with ophthalmoscopy. When it comes to treatment, just treat the underlying cause or causes, like I've just listed them, tumor, inflammation, and so on. Then refer to ophthalmologist, and that's it. So you don't need to waste your time here. Refer to ophthalmologist who will be able to do everything to help the affected individual. Thanks for listening to my presentation. Kindly subscribe so that you can get this immediately they are published. Thank you.